Today we're here with Brett Coble, President and CEO of Bridges Health. Thanks for stopping by.
Thanks for having me. Great to be here.
Well, I'd love to hear the stories of how people get started in the long-term care industry. So tell me how you started your career here.
Well, for me, I'm second generation, so my family got into the nursing home business when I was 15 years old and went to work in the facility virtually day one, working in housekeeping, laundry, dietary, maintenance, anything and everything that I could do, and decided to come back and make a career of it after college, and it's all I've done, and it's just been so rewarding.
Well, you've had several years in the industry learning, and yet you're at an organization now with Bridges Health that are just at the beginning of their population health management journey. So what are you learning at that beginning stage? What do you need to learn to move farther along in that journey?
I think, for us, we're trying to understand all of the different population health models that are out there and what is the best fit for our organization. We're a little unique in that we've got 36 locations, 33 SNFs and 3 assisted livings, but all in Oklahoma. And about half of them are rural and about half are urban. And so as we look at the institutional models, for our skilled nursing facilities or the home and community-based programs that we certainly are interested in participating in, we're just trying to understand what's the best fit for us in the markets we serve.
I think that's a common thing, is that there's so many choices and sizes and plans and differences that just kind of finding that right model for your facilities is really kind of the trick of the beginning of the journey. So you mentioned rural and urban populations. How can you balance those within sort of a single model of care?
Well, we have a lot of urban buildings that look a lot like rural buildings, where we have a primary long-term care population, primarily served by Medicaid resources. We're in the same state, so culturally, there's not a lot of difference between our metro areas and our rural areas. We're just people taking care of people at the end of the day, and we believe if you treat people well, they'll return that favor.
I love that. What a beautiful motto. How have partnerships played a role in this? Have you, worked with consultants or other companies to help you sort of move along in this journey?
Yeah, I think networking with our peers, other providers in state and other providers out of state, and then, some of the insurance providers have been so gracious in helping us understand the models that are out there to try and understand which is the best fit for our organization. I think the networking atmosphere of the Population Health Summit is really special in that way because it allows us to engage folks more than just in a classroom setting.
Mm-hmm. That's one of the things I love about the industry is everybody seems very generous in sharing their experience and knowledge and things like that. Very much a spirit of community about that.
Absolutely.
Well, thanks for spending a few minutes with us today. We appreciate it.
You bet. Thanks for having me by.